Its donations save the lives of millions each year, and it's something that cannot be made in a lab, blood. And this week's What's Going Around, why it takes people like you to make it all happen. People have been rolling up their sleeves for a community blood center of the Ozarks since 1995. But as the frigid temperatures bring life to a standstill in the Ozarks, the winter weather is also slowing down donations.
January can be kind of a challenging time on the local blood supply due to winter weather and illnesses. We have blood drives that cancel. We go to a lot of high schools and schools aren't in session right now. So right now we're down about 200 blood donations that we've lost for the month of January.
Michelle Teeter, the media relations coordinator for CBCO, says it's part of a wider decrease in donations blood centers across the U.S. are seeing. Donations to the American Red Cross are down 40% from 20 years ago.
I think, COVID played a role in that. People weren't at the office. A lot of people were working more from home, so they weren't getting out. So mobile blood drives and things like that were canceled.
And she says being the sole provider to 45 hospitals in 3 states takes a lot of donations to keep up.
We need about 200 blood donations a day. We have 4 donor centers, one in Springfield, one in Joplin, one in Springdale, Arkansas, and one in Bentonville. And then on average, we do 5 to 7 blood drives a day.
She says those donations save the lives of many.
So about 25% of our blood supply goes to cancer patients. Platelets are used for burn victims. A lot of times during childbirth, things can happen and they need a blood transfusion. Traumas and tragedies, car accidents, surgeries.
To be an eligible donor, Michelle says you have to be 17 without parent permission, 16 with, weigh at least 110 pounds, and feel well that day. If you have any further questions about your eligibility, she says call the blood center and ask. In other parts of the Ozarks this week at Lake Regional Health System, their primary clinics only had 37 positive COVID tests, which is down from last week. However, in their hospital, they have seen a slight increase in positive COVID and flu tests over the past 2 weeks. And CMH in Bolivar, they had 1 COVID patient and 1 flu patient in the hospital. Across their whole system, they had 72 positive flu cases, 54 COVID cases, which they say continues to go down after the high during Christmas.
A gas station